All right, so Parliament is rising tonight for the Easter break, and we're going straight to the House to listen in on deliberations on as it takes place right there on the House. Let's listen in.
As early as practical, I urge the committee to engage all political parties, civil society organizations, security experts, and other stakeholders during the recess period before the consideration of the bill to ensure the passage of a very robust law that will stand the test of time. I commend His Excellency for fulfilling his promise. It is my firm belief that upon the passage of the bill, Ghana, and for that matter, all political parties in this country, will bring a closure to the business of vigilantism. So, Speaker, let me take this opportunity to thank you and your deputies for the very productive manner in which the business of the House came to be conducted. I must also express my sincere gratitude to members who have worked tirelessly and diligently to ensure the effective execution of the business of the House. So, Speaker, I cannot refuse to mention the cooperation that I've had from the minority leader, the Honorable Haruna Idrisu, in whom I'm most of the times well pleased, even though on very few occasions he has attempted to spring surprises. But, Mr. Speaker, that indeed is part of parliamentary democracy. Let me thank in particular, once again, members of the Winnowing Committee who have offered tremendous assistance to me in times of need. It may become necessary to fall on them again to complete the company's bill during the recess. Mr. Speaker, I'm suggesting to them that beginning Monday, we move into conclave once again to consider the remaining provisions in the company's bill between Tuesday and Wednesday, so that will bring those matters to a closure. So, Speaker, I thank them in anticipation of their usual cooperation. The House has had to sit for extended periods in order to have enough time to dispose of business in the House. All in all, we have had a very eventful session and a fruitful discourse during this meeting. The entire membership of the House worked exceedingly hard, as the House had to have more than 20 days extended sittings. That indeed is unprecedented, and I must show my profound gratitude to members, especially the very diligent ones, numbering not more than 50, who stayed with us through thick and thin. Mr. Speaker, I noticed the head of the Honorable lecturer, and I believe he wants to be recognized. The Speaker, I broke my heart to him. He has been most diligent and has assisted. I'm equally grateful to the clerk and the staff for working tirelessly to ensure that the work in the chamber goes on smoothly. To the Parliamentary Press Corps, who transmit events from the chamber to the citizenry, I thank them for their efforts and urge them to continue with this all-important enterprise. Speaker, may I conclude by wishing all of us well as we continue with the discharge of our responsibilities during the recess, and to the Christians amongst us, not to forget the lessons of Easter. Speaker, thank you very much for your indulgence. Once again, I thank my colleagues for the support that they have provided leadership. Speaker, thank you once again.
So we just came, we're just coming out of Parliament. We're live, we brought the live proceedings of Parliament. Let's join our parliamentary correspondent, Joseph Opoku Gakpo. Hello, Joseph. I know a number of things have been taking place in the House the whole of today, and the Parliament is sitting late. But what do they just witness?
And so after the House put out a vote on the Bono regional minister designate, who's just been approved, Evelyn Kumi Richardson, the House took a decision that would hear the closing addresses, starting with the minority leader and then the majority leader, after which now we are expecting that the Speaker of Parliament, Professor Mike Okoye, would give his closing address, and then they would adjourn sitting indefinitely. So a number of other businesses that have been tabled are actually being deferred until they return from their break for an emergency sitting. In fact, This particular break is supposed to last for at least 2 months, but the decision is that on the 29th of April, they would be back for an emergency sitting during which they would consider a number of things, including the bill on vigilantism that you heard the majority leader make reference to, as well as all the other outstanding documents that they should have looked at today that they couldn't, including documents that have been laid seeking a tax waiver to the tune of $82 million for the Sino Hydro project that particular firm will be implementing in order to construct roads and other projects right here in Ghana, and also the vigilantism bill. And so the House will be adjourning right after the Speaker, Professor Michael Quay, completes his closing address, which is about delivering to members of Parliament.
All right, I believe the Speaker is giving his closing address, so let's listen in right now.
2019, the Payment Systems and Services Bill 2018, Chartered Insurance Institute of Bankers Ghana Bill, and the much anticipated Right to Information Bill 2018. The Ghana Iron and Steel Development Corporation Bill was passed today. The House approved of the President's nominees as ministers, concluding that process today to give His Excellency the President full complement of his ministerial request for him to perform his executive function. It is worth noting, honorable members, that 9 senior high school students comprising male and female became beneficiaries of Parliament's recently established excellent relationship with the Republic of Serbia, pursuant to the Speaker's historic visit to Serbia last year on the invitation of the Serbian authorities. They will be trained in medicine, pharmaceutical science, and engineering. Parliament continues to play its role in diverse ways to promote national development nationally and internationally. A number of honorable members are benefited from a number of foreign travels to broaden their perspectives in the parliamentary processes. Let me emphasize that in the future, no clerks will be allowed to accompany a delegation until they submit all outstanding reports pursuant to the travels Parliament has granted to them. Parliament as an institution must develop and strengthen its information and database and knowledge formations. This, the board takes very, very serious indeed. Punctuality to plenary sittings continue to have marginally improved. We trust that we will continue to make great successes in the near future. Honorable members, statements made on the floor have been well researched and most intelligently made. I congratulate the honorable members for every serious effort made in this direction, and I believe that the call for further analysis and recommendations will be made so that relevant legislation may even emanate therefrom. All members are reminded, honorable members, again, of the newly established legal department where assistance will be offered to interested members for drafting of private members' bills. The construction of a new chamber block will soon begin. Indeed, architects and contractors have been duly identified by a competitive process. The Parliamentary Service continue to pursue with great interest and effort human resource management of the members of staff. Aside, a number of in-house vacant positions have been identified, and matters regarding promotion of the more junior ranks are in process. I have directed that until the lower officers have their cases dealt with, senior level appointments will wait. May I take this opportunity to advise the staff to also use laid down processes for grievance ventilation rather than hastily resorting to the media with uninformed stories. Honorable members, as the House goes on recess, let me appeal to all committees to finish all unfinished business within this period. It is my expectation that honorable members will take good care of themselves, in fact, the whole of Parliament generally, so that we have an enjoyable Easter and come back to work in due season. I value in no uncertain terms the huge assistance proffered by the deputy speakers, the majority leader, minority leader, and in fact the leadership in its entirety. They've been up to the task and above all be dependable in steering the affairs of this honorable house. To the clerk and the entire staff of the Parliamentary service, I record with appreciation your invaluable service, which has to a large extent assisted the work of the House. This includes also the Parliamentary press. May the good Lord Almighty bless you all as the House goes on recess, and may He ensure your safety and the safety of all of us until we meet at the appointed time. I wish you all a happy Easter in advance. This honorable House, at this juncture, is adjourned sine die. Thank you very much, honorable members.
Right, so there you have it. The Speaker of Parliament adjourning the House, but they will be returning on April 29th for an emergency session. Now, one of the things that the Speaker talked about was the RTI bill, which has been passed. But today is a number of bills and loans were approved as well. One of them is what we're going to be talking about now. And work should soon start on the abandoned maternity block at the Konfano Teaching Hospital following Parliament's approval of a €155 million loan to complete it. The project started 44 years ago, remains uncompleted, resulting in congestion at the hospital's mother and baby unit. The death of newborns and mothers as a result of the congestion inspired Joy News' first special assignment documentary, March 2017, Next to Die. Please watch this excerpt.
As you can see, we have only 2 beds, so unfortunately if we have more than 2 patients delivering at the same time, it means that one person has to deliver elsewhere. At times we have patients delivering on the floor because the place will be full, the patient will come in second stage, and that you need to conduct the delivery on the ground.
And what could be the effect of that?
The effect is the infection. The baby can be infected. This place is very busy. At times we can have like 10, 12 cases waiting to be done.
Waiting?
Yes, waiting.
Meaning they're in a queue?
Yes, they are in a queue. So we sort them out. So we do the more urgent one first. That's how we do. So we sort the cases out. And at times you can have 2 or 3 emergency cases that you need to sort them out at the same time, and it creates a lot of problems.
So what do you do?
When it comes to that, you prioritize them. So you choose the one that is more urgent, and then you do it, and then later on you come and attend to the next one.
All that as a mother we are doing here is praying your baby will get well, and then you go home. Because you look at the condition here and you are scared. You ask yourself, is my daughter going to get better? Is my son going to get better? Because that is not what we are expecting. You know, in healthcare, we call something holistic care. And that is the kind of care that we are expecting to receive. But you come here and you're not getting that care. So you ask yourself, then why am I here? I see mothers lying on the floor, lying on these hard benches. You wake up in the morning.
Bed bags.
Yes, with bed bags. Even when you are sitting on it, you can feel them biting and sucking your blood.
The next is a mother of 10. She delivered triplets to hit this number after her 7th child.
and he found a year Kujari, and he found a year Johnson. You need baby, I have Johnson. You want which the Mupa, and see a slab answer one way. Sabaya and Waya. Yea, if I any idea what would it swabba and my home. So one wow, Bessie then, and if I be I have a twabamo, Wababi Yan. And see, say, yeah, I happen for me. Say you are. I took a 4 moments now, I said, and so may fair HDMI. And I buy boy and a year more than a diawo and I took a 4 moments so I buy a few mono.
This is certainly not the only problems these mothers face here. The hospital has managed to secure one room for all the mothers, but the only difference between this room and the prison cell is that this room does not have an iron gate with heavy padlocks securing the doorways of prisons. This problem of needless maternal and child deaths, the spread of infections, as well as the unimaginable congestion currently being experienced here were envisaged some 43 years ago by the then head of state, General Kutu Champong. So General Champong in 1974 started a move to prevent these from happening. He started the construction of 3 blocks, 2 7-story and a sub-basement, and 1 6-story building with a total capacity of 995 beds. 9 regimes after, the project has still not been completed.
So this is the building we have been talking about. This was started in the 1970s by the Champong's regime, and we have been told it is the solution to the maternal and infant mortalities in this hospital. As you heard one of the professors tell us, a number of children have died in this hospital simply because they didn't have space to accommodate them when they were ill. Mothers have died because they didn't have space to accommodate.
So that was Next to Die, that was put together in 2017 by Sir Kwame Boateng. Now, thanks to the First Lady, Rebecca Kufuor, who joined forces with the multimedia group to mobilize funding, a new ultra-modern structure to ease the congestion was built, and this is one of the wards of the new structure. But the president also promised the abandoned structure will be completed. Well, the loan for the project has been approved, and the new block, when completed, will have a 750 to 800 bed facility and 10 theatres, among others. The project is expected to be completed within 3 years. Parliament is confident when completed, the project will drastically improve the provision of health care in the country and the West African sub-region. Deputy Ranking on the Finance Committee, Alex Adumako, is hopeful the infant and maternal mortality will reduce.
It will have significant impact in the healthcare delivery, in Ashanti region and in Ghana as a whole, because you realize that Komfanoche Teaching Hospital is a major referral facility, not only for Ashanti region, but also for the northern part of this country, from Upper West, Upper East, the northern regions, and even beyond, Burkina Faso, Cote d'Ivoire, and a lot. So we think that this facility, if it's completed, would help reduce maternal mortality. It will help reduce neonatal mortality, which is a major problem, especially in that part of the region. And it will help tackle other cases that will be referred, from the surrounding districts. And if we look at it, the way it is designed, even since 1976, you realize it will come with about 9 theaters. You can't find this in any facility in Ghana because you have 9 operating theaters, and with another 1 on the ground floor, that will make 10. And in Komfanoche, when you have that, it's a major transformation, because I was trained, in that facility, and we just had 1 operating theater for the maternity ward. So what it means is that mothers would wait for 1 case to be done before another mother could be operated upon, and that resulted in either the fetuses dying, the mothers dying, or having 1 complication or the other. So it will be a major boost to healthcare delivery in Ghana.
And the committee's report rightly observed, the high rate of maternal mortality within that particular enclave. So this going up, you envisage things will change in the figures once the project is done in 3 years, I suppose?
I hope so, because it will change the waiting time for pregnant women who are in labor and have one complication or the other. It will reduce the waiting time for even cases that have been referred from the peripheries, but that will also have to, that one alone, I wouldn't say would just turn things around. We also need to look at the peripheries, the district hospitals and the surrounding facilities to ensure that they are also well equipped, so that they can tackle the minor cases, and the major cases will be referred to Komfo Teaching Hospital.
Now, the House also separately approved the contract agreement between government and the contractor Construction UK Limited for the company to undertake the project. Now, the minority in Parliament is questioning the signature of the Vice President on the list of presidential staffers submitted to Parliament. The list is in compliance with Section 11 of the Presidential Office Act 1993, Act 463, which requires the President to submit annually to Parliament a report on the staffing position of the Office of the President. The 2019 submission, however, went before Parliament with the signature of the Vice President, and this, the minority says, requires explanation. Here's Ranking Member on the Foreign Affairs Committee, Samuel Okudzeto-Ablakwa.
He signed as acting president. Maybe he signed the document when the president was away. He didn't indicate that. He didn't also indicate that he was signing for the president. He just signed it and submitted it to the Speaker for the attention of Parliament. So as I say in my write-up, it is yet to be seen what view the Speaker will take on the matter, because the law is very clear. And what has been the practice all along has been that the President personally signs the communication to Parliament. And so there's so many breaches that are occurring before our very eyes. Then when you come to the details of the annual report.
Is it that significant that maybe the report has to be withdrawn and relayed, you envisage?
That is why I want to defer to the Speaker. I think that the Speaker will have to give a ruling on the matter. I was.
The report is rejected.
It doesn't appear to me that it is properly before Parliament. The Speaker may have to rule that the executive will have to come back for their document and resubmit under the name and signature of the President. That has been the practice, and that is what Section 11 of the law says. And I'm surprised that this current government is deviating from what has been the norm and what has been the dictates of the law. One of the three reforms I'm calling for, the amendments to this law, should be: one, a cap so that we can place a ceiling; two, there are clear abuses of the Presidential Office Act. The contemplation of the drafters of this law did not envisage that, for example, you appoint hordes of people as special advisors, special assistants, special aides to ministers who are not under the office of the President. We are seeing an abuse of that. I've counted over 20. We need to amend the law. And thirdly, there ought to be clear sanctions when we amend the law. What should happen in instances like this when the President is in breach, or when a President refuses to submit to Parliament? So I've been consistent over the years that we need to carry out these amendments.
Mr. Ablakwa is also questioning what he describes as the omission of certain names from the list.
The list that the Vice President has submitted to Parliament clearly misleads Parliament. If you look at Appendix C, a list of ministers are provided. And then you go to Appendix D3, we are given the number of ministries under the office of the President. The two appendices are incompatible, strikingly. So whereas Appendix C gives us 10 ministers who are the ministers of state under the office of the President, you have two ministries omitted in Appendix C. The Minister for Zongo, Inner Cities and Zongo Development, the Honorable Mustafa Abdul Hamid, is not listed. He is conspicuously omitted. The Honorable Minister for Aviation, the Honorable Kofi Adda, is also not listed. He is conspicuously missing. Then let us remember that
these substantive ministries on their own, to the extent that the ministers, they are not necessarily presidential staffers, or ministers.
No, it is not possible. Once Appendix D3 states that these are the ministries under the office of the president, the ministers operate under the office of the president and should have been listed. So you see an attempt to downplay the numbers.
We're taking a break here on Joy News Prime, but still ahead in the bulletin, government has secured a $200 million World Bank facility to improve Accra's drainage network and tackle perennial flooding. And then in business, Ghana Gas hints of settling its debts as it promises to pay $20 million in dividend to government by the end of the year.
Government of Ghana of about $20 million. And it's a fact that I'm giving it to you. This is because you said that I want to put it to you that nothing is affecting our operations. We are working and we are one of the companies that is very viable in the country.
Stay tuned in. Sandra Fen will be here with the business news in a bit. Works and Housing Minister Samuel Atachian has revealed Ghana has secured a $200 million facility from the World Bank to permanently address the perennial flooding and sanitation challenges in and around the Odor drains. Speaking on the state of the country's drainage situation and the stalled Conti project, among others, Mr. Atachian enumerated a number of flood-prone areas expected to benefit from the facility. Maxwell Agogba has more in this report.
We know when the rainy season starts, that desilting should have started in the dry season, not when it's raining. So I hope it's not too little too late. And I hope it's not a situation where, again, we start lamenting about the loss of lives when we could have avoided this situation by taking preemptive measures. It's one thing to reassure people, but when the event happens and you see what happens, that's when you know whether it's actually working or not. And to date, I don't think that enough has been put in place to ensure that people don't lose their lives or their livelihoods as a result of the flooding.
Kole Clotte, Member of Parliament, Zanat Rollins, talking about how the Odor drain is choked with silt and plastics. The silt have choked the drain to the extent that it is possible to walk inside it. Some residents we have been speaking to are concerned the silt removed from the drain will get back into it if it is not collected. Minister of Works and Housing Samuel Atachian says Ghana has secured a $200 million facility from the World Bank to permanently address the issue.
So it's a money issue. The World Bank has had to appreciate the fact that we didn't need $100 million to do this. And when we really pushed them that to give it a permanent fix, so that at the end of the day, Ghana can rest for a long time, they've increased it to $200 million. And $200 million, we believe, will be able to sort of contain the kind of things that we are going through now. And give ourselves next year, we'll be able to tackle the Odor challenges. Look at just Odor. Odor is not Ghana. And if Odor is eating away $200 million, what are we going to do about it if we don't get the political will and get serious money to do what matters? And this is what we are doing.
But which other solutions are available?
It has been 1 week since the inauguration of this integrated recycling and compost plant. 1 week after the pump and pageantry, we are here to find out if this place is really living up to its billing. We're here to meet the quality assurance manager here, Dr. Glenn Jima. He tells us this is the solution to Accra's sanitation and plastic woes.
Realize that it is something that brings socio-economic development to individuals and to the nation as a whole. Because you could see that a lot of people have been given unemployment. Employment number, the direct labor, and then the indirect labor is innumerable. You just can't number them. So there's quite a huge kind of benefit that the people in the society and the economy benefits. That is the second thing that I want us to understand, is that this particular facility too is one of its kind. And we know we have technological universities in our country. we have polytechnics, we have technical universities, we have KNUST, and all those, they all need a place for research. And so this also has come as an environment open enough for technological research, for training and development. Looking at the compost, one of the end products, the compost is something that I believe we all need. It's not going to end up with our farmers alone. Our farmers will use it to build up the soil structure, the fertility, so that the soil will be very fertile to grow up our crops, so that the crops will be healthy to produce good and a healthy product for our use.
After several months of drinking dirty water, Mangotideke, a village in the Volta region, now has its dysfunctional borehole flowing properly. A Joy News Safe Water campaign and a hotline documentary titled Left Behind put the spotlight on how the first of 2 boreholes constructed for the people produced not a single drop of water, whilst the other gave them not more than a panful a day, a situation which compelled the villagers to drink from a muddy stream nearby. The stream has since dried up, but there is enough water to go around the community now because engineers have corrected the anomaly which impeded flow of the water from the borehole. Gift and Apia as well.
This is the first borehole the village received. Not just is it situated far away from the village, but it never produced water for them. In 2014, they got a new borehole from an NGO through then DCE Michael Ajaho after Joy News told the story. That borehole had a similar problem, producing a little above a pan of water a day. That situation compelled them to drink from a very dirty stream.
The water is dirty, but that is our only option. We have the borehole, but it does not collect water. We sometimes filter the water before drinking it. When I see the DCE, I will tell him to look at the water and use it. If the water is not good for him, then he should come and dig a good borehole for us.
I've come to check on the stream. The whole of this place used to be filled with water. At least that was the situation last year when I came here. And the people in Mangotideke depended on that water to augment a borehole that did not flow. Following the hotline documentary, Karen DCE Dixon Jokwe told Joy News the assembly had provided water tankers for the village, a pronouncement which turned out to be false. The community is not happy.
The DCE promised us some water, but he didn't bring it. He didn't bring the water, and it's affecting the town. It bothered us a lot that he didn't bring the water. I would say he hasn't done well enough in that regard. He should do well and get us potable water.
Well, today, that dysfunctional borehole flows much better, as a couple of the men here demonstrate to me now. Member of Parliament for the area, Charles Agbeve, sent in engineers to fix the problem after the hotline documentary Left Behind and the Joy News Safe Water project put a spotlight on the situation. The residents, however, still want a more sustainable solution to this water problem, and that is to connect pipes from the district assembly, where pipe-borne water flows every day, to the villages here. Gifty and Doppia, Joy News, Mangotideke, Volta region.
The National Premix Fuel Secretariat says the absence of colour in the premix fuel distributed to them does not in any way affect the quality of the product. The assurance comes on the back of a news conference at Elmina in the Central Region, where the fishermen suggested the new fuel is substandard and causing a breakdown of their outboard motors. At a media briefing at the Fisheries Commission, Chairman of the Premix Board, Ni Lanti Banaman, said fuel coming from the Tema Oil Refinery is safe due to the strict checks done by the National Petroleum Authority.
The National Premix Fuel Secretariat for the first time has enforced provisions in the LI 2233 clause 27.2, which states that each landing beach committee shall open a bank account for the fishing community into which 53% of the proceeds of margins from the sale of premix fuel shall be paid. All this is that is landing beach committees, which hitherto could not account for any amount in their accounts, presently have been able to accumulate funds in their accounts for developmental projects in their communities. This is an aberration from the past, where funds belonging to the community were used for personal gains. For anyone or group of persons to suggest that the absence of the blue dye has lowered the quality of the product is not only laughable, but a clear case of stark ignorance on the part of the proponents of the press statement. The Temoya refinery is the only mandated body that blends premix fuel in the country. And relevant stakeholders such as the National Petroleum Authority, that's the NPA, have constantly ensured that the product is of the highest quality and subjects it to a series of quality assurance tests before it goes onto the market. Premix fuel produced by TOR consists essentially of super, that is petrol, marine engine oil, and blue dye. And the blue dye is only to give it a distinctive appearance to distinguish it from the other fuels.
You're watching Joy News Prime, and moving on, the immediate past Pro-Vice Chancellor of the University of Cape Coast, Professor George Oduro, has described the Public University Bill 2019 as ridiculously complicated. He says in its current context, the policy will not work. According to him, if the bill is allowed to go through in its current state, it will greatly undermine academic freedom in the country's universities. Speaking at the launch of the 56th SRC Week celebration at the University of Cape Coast, Professor George Oduro called on students and well-meaning Ghanaians to take off their political cloaks and defend the academic freedom of universities. Richard Kojunyako has more.
Professor George Oduro indicated for universities to actualize their full potentials and contribute meaningfully to the development of the nation, there should be a conscious effort to deal with political influence permeating into the administration of public universities. He says the proposed bill has a tendency to kill academic freedom and autonomy of public universities. He is therefore urging students to study the bill and make their inputs devoid of political expediency.
In this context, I challenge students, in the light of promoting peace for sustainable development and stability, not to stay on the fence for the sake of political convenience in the current seeming tension brewing on our campuses as a result of the Public Universities Bill 2019. Students must study the bill, which in my opinion is ridiculously complicated, contextually unworkable, and operationally suppressive, with the tendency of killing academic freedom and autonomy, which are key ingredients in creating congenial teaching and learning atmosphere on our campuses.
Professor Oduro says political pronouncement, agitations, manipulations characterized by tensions associated with the removal, appointment and restoration of vice chancellors in the cases of the University of Education Winneba and the Kwame Nkrumah University of Science and Technology provide evidence of the extent of partisan party interferences which are fast eroding the academic freedom and autonomy of universities.
Globally, autonomy and academic freedom of universities are regarded as necessary ingredients for quality delivery of university education. Autonomy provides a university the liberty to organize its own internal affairs as an independent corporate entity. Hence, each university is governed by an act of parliament and statutes, with governing councils as the highest decision-making body. Academic freedom, on the other hand, secures the right of faculty and students to engage in teaching and learning and undertake academic discourses on all national and social issues within the confines of the university without external influences.
The theme of the celebration is university students as pioneers for sustainable national peace and stability. Richard Kwejenyakon, Joy News, Cape Coast.
Now, staff of the WA Small Tax Office of the Ghana Revenue Authority have come to the aid of the infant diagnosed with hydrocephalus and spinal bifida at birth at the Nadoli Government Hospital. Doctors at the hospital say the boy is just a few days old. The boy, who is just a few days old, will not survive much longer unless he undergoes the surgery. The GRA staff were able to mobilize 2,280 cedis in personal contributions in the office, which they handed over to the family. They say they were touched by the infant's story.
The young man trusts me, so everybody will be part of it. As part of our Governance Week celebration, we saw the plight of the little baby, and then we felt that there's a need for us to come to the aid and also contribute towards the treatment. So the staff really contribute. The staff of YSU GRE make small contributions from their own source to help the treatments. Our issue is not only to enforce laws, but also take care of our social responsibility. So that's why we try to make this donation an amount of 2,280 Ghana cedis towards the treatment of the boy.
I'm also standing on behalf of the family of the little baby that we showed on telly a couple of days ago on Joy News, requesting for support to be able to have a surgery for this poor, vulnerable baby who doesn't even know what is happening. So I must say that I'm very, very happy. And this will go a long way to help this little child. We'll start the processes as soon as possible. And we pray that everything will go on well with the child, and this child will come back to live with us. Thank you very much.
Amen. So, and I'm Israel. I thank you very much for watching. You have a good night and a great weekend.